Have you ever pondered the distinctions between a gastric sleeve and a gastric bypass? Both procedures are used in the fight against obesity, but they differ in several ways. Today, we're going to delve into these differences to help you understand each procedure better. Let's start with the gastric sleeve. This procedure involves the removal of a large portion of the stomach, leaving behind a sleeve-shaped stomach. The weight loss mechanism here is simple. You're restricting food intake due to the reduced stomach size. This typically results in significant weight loss. One advantage of this procedure is that it doesn't involve rerouting the digestive tract, which may appeal to some individuals. On the other hand, we have the gastric bypass. This procedure takes a different approach. It involves creating a smaller stomach pouch and rerouting a segment of the small intestine. The weight loss mechanism here is twofold. Not only are you restricting food intake, but you're also causing malabsorption of nutrients. This often leads to substantial weight loss and may result in a better resolution of certain comorbidities. When comparing the advantages of these two procedures, both are effective in achieving weight loss, but the extent can vary among individuals. In terms of resolving comorbidities, gastric bypass may have a slightly higher impact, particularly on conditions like diabetes. However, it's important to examine the disadvantages as well. Both surgeries carry risks such as infection and blood clots. Furthermore, gastric bypass may pose a higher risk of nutrient deficiencies due to the malabsorption aspect of the procedure. Now, let's look at some statistics. Studies indicate that gastric bypass may show a slightly higher percentage of excess weight loss compared to the gastric sleeve. Additionally, the resolution of diabetes is notable in both procedures, with some studies suggesting a higher rate in gastric bypass. In conclusion, both the gastric sleeve and gastric bypass are effective weight loss surgeries, each with its own set of advantages and disadvantages. It's crucial to consult with a healthcare professional to determine the most suitable option based on your individual health conditions and goals. Remember, the goal is not just to lose weight, but to do so in a healthy and sustainable way. On that note, we end today's exploration of gastric sleeve and gastric bypass. We hope this has given you a clearer understanding of these two procedures and their differences.